All right, so in our last screencast, we sort of were wrapping up levels of organization. And so we kind of ended by talking about these body cavities, these little spaces inside where organs are. And it's kind of interesting when we do dissection later, when you cut into the organism that you're dissecting, what you find is there's like space in there. That space is where the organs are. So that kind of makes sense. So I'd mentioned that a hernia happens when there's a weakness in the body wall, and organs that are suspended in that little space start to bulge outward. I think the easiest one to understand, and you don't need to know the different types of hernia, but the easiest one to understand, I think, is an incisional. You can imagine if you've had a surgery and they make an incision, that's going to be a weak area of the body wall, and so it's possible that you might have things kind of bulging outward in this way at that point. But I wanted to mention one particular type of hernia called an inguinal hernia. This really only affects men. And gentlemen, have you ever heard the phrase turn your head and cough? If you have, that's related to this. So to catch everyone up, in case you're not familiar, sometimes during a physical exam at the doctor will say to a male, okay, or they'll ask you to pull down your pants, and it's this awkward, like, what's going on here? And then they say, turn your head and cough, and you turn your head, you cough, huh, and then they say, okay, pull your pants back up, and you're left wondering, what was that about? Well, here's what's going on. When the testes develop, the testes are initially formed in the abdominal cavity during fetal development. So before you're born, the testes are actually in the abdomen. And then slowly over time, they descend down through the body wall into the cavity. So a little opening has to sort of form, and then the testes kind of descend down through that opening, and then the opening kind of closes around them, and there's blood vessels and nerves and things like that that kind of link the testes to everything else inside the body cavity. But what can happen is that little closure can become weak, and there might be a little gap there. And the reason why they say turn your head and cough is because coughing creates this pressure in the abdominal cavity. And if you have that little sort of weak opening between the blood vessels and nerves descending into the where the testes are, then when you cough, air is going to be able to get down into the scrotum, and it's going to kind of expand outward. And I'm exaggerating the extent of this, but there's a little, and it kind of swells out, and that tells the doctor, there's a little gap between those blood vessels and nerves and things, and that's going to be a problem because if not addressed, if you put a lot of stress on the abdominal cavity, say by lifting a heavy object, look what can happen. The intestines can actually be pushed down into that little opening there. And that, I guarantee you, is going to get your attention, gentlemen. And so this becomes extraordinarily painful, and then blood flow to the intestines can be pinched off, and then the intestine tissue starts to die. That's a big deal. So turn your head and cough is simply a way of checking for this weak spot so that it can be addressed before this kind of thing happens. Now you might wonder, well, why is it turn your head and cough? Why not just cough? Well, it turns out that it used to be just cough, but then doctors kept getting coughed on, and doctors are smart people, so they held a meeting and said, hey, what if we had them turn their head first? That's it, we'll do it. And they did it. So that's why it's turn your head and cough it, so they don't get coughed on. Okay, so that's it for the first kind of section of this course, levels of organization. And then the homework assignments are on Schoology, and those are going to be available and posted, and we'll talk about that later. But at this point, you're kind of ready for that first chunk of homework assignment. And if you're struggling on that first chunk of homework assignment, you can go back and review these slides. So here's just some review questions if you want to take a look at that on your own. So the next topic in this course is sort of the vocabulary of anatomy and physiology, just some basic terms that come up a lot that you just kind of need to know. And there's actually an activity that hopefully by the time you've watched this screencast, you've done this. It's called a spogle, and it kind of introduces these directional terms. So I'm going to assume that you've done that. It's available on Schoology. And if you haven't, maybe stop watching and do that activity. It's well worth it because I'm just going to briefly go over what you learned in that. But here's the gist. So in terms of just general vocabulary around this, Anatomists refer to something called anatomical position. Basically, you have your person standing straight, facing forward. Note that the thumbs are pointed outward. That's important. There's what is called a midline, which goes down the middle of their body, imaginary line. Note that left is from the point of view of whoever you're examining. So left is actually this guy's left, not your left. So this is the left side, this is the right side. And then points of attachment refer to places where the arms and legs attach. So that's kind of just sort of some general anatomy here. And then there's these directional terms that you learned. I'll go through them briefly. So anterior is towards the front of the body. Posterior is towards the back. And I should point out, you have this diagram in your study guide, and you could add these terms as you're watching the screencast. So anterior is towards the front, posterior is towards the back. And then the next pair of terms, superior is towards the top of your body. Inferior is towards the bottom. The next pair of terms refer to that imaginary midline. So medial means towards the midline. Lateral means away from that midline. The next terms refer to those points of attachment. So closer to the points of attachment means proximal, and then away from the points of attachment mean distal. These can also be used for any, refer to any point on the body. So you could say it's proximal to the belly button, meaning closer to the belly button than we are now. Finally, superficial and deep are next. These arrows don't really make much sense to me, but superficial is sort of towards the outside of the body, and deep is towards the interior of the body. So in other words, if you were to take a power drill and just kind of drill into my skull, you start superficial and then you go deep. And then as you pull the drill out, you go from deep to superficial. Side note, please don't drill into my head. So again, these terms, you've got to do that Spogle. You've got to work with these and you've got to practice them. And that Spogle will give you an opportunity to kind of play around with these and work with them. Just listen to me. It's like math class. Just listening to the teacher talk about it isn't enough. You've got to do some practice problems and try it. So definitely do that. Finally, we have body planes, different ways of slicing the body so that we can look at the internal anatomy. So this cut that kind of divides the person into a left and right half, that is called a sagittal section. And here's an example of a sagittal section through the female body that shows the reproductive structures. And I remember in 6th grade, my teacher showing me that picture and saying it was the female reproductive system. And I was really confused because I didn't know much, but I definitely didn't recognize anything I was looking at. And I think it's because I was thinking I was looking at a frontal section, which is next, but this is a sagittal section from the side, and that just didn't make any sense. So it's helpful to understand these so you know what you're looking at. A frontal section divides the body into a front and back half. So here you can see a frontal section that kind of shows the heart and lungs. And then this is a transverse section, which kind of goes into a top and bottom. And so here you can see a transverse section through the head. This is actually the brain, which is kind of weird. The eyeballs. This is part of your nasal cavity. So by knowing the different types of ways we cut the body, we can understand what we're looking at a little bit better. Again, the Spogle goes through that really well. Feel free to try and do this practice. Hit pause and see if you can identify these. But orange is frontal, green is transverse, and blue is sagittal. So that's it. Again, this is something you have to do and practice, so this screencast is not sufficient. Do that Spogle, and then there's some practice in this Schoology homework. So that's it for this one. Thanks.